And then here we go.
Alrighty.
I was thinking about doing the headphone thing too, and I was like, I probably need to be able to hear if the dog's screaming.
Right. No, you're sounding really good. So I just need to text one
Yeah,
person real
sure.
quick and then I am all you.
Yeah,
I
if you'd
saw
like to
your
hold those the credit cards up for the camera too on the back side of your phone there, so that way our audience can make a few purchases
are
after.
are we recording right now?
I'm recording, but I could just take this out. No, you're good. I'm just because it's all like I said, it's all recorded, so it's just like
Okay.
go back and start from a different point. It'll be fine.
That's funny. Okay, no, I'll just wait.
No, no, so
Can send that. No,
actually,
it's no big deal. It's
are
really
you
no big deal.
sure?
Yeah. Mm-hmm.
So, no, honestly, thank you so much for taking the time to do this with me today. I know that you're super busy because you work between Georgia and Texas. I mean, I just saw the call come through and it said Austin, Texas. And I was like, oh, yeah, the only person I know. uh,
Yeah, I have like a Google number, and so I started it when I was in Austin, and I just never changed the number.
yeah, you should keep it. It's part of your character, right?
Exactly.
That's kind of like me with my New York number. I never gave up my even actually it's even more outdated than that because it's the county. It doesn't it's not even for the county I grew up in anymore. It used to be like
Wow.
all of Long Island, and then
Uh-huh.
they halved it, and now like one is 631, mine is 516, but it's supposed to anyway. That's not
Yeah, that's exactly how the 512 is too.
oh
That
really?
that was the only area code for Austin, and then they had to get a new area code, So yeah.
Well, I mean, I guess with all the development, right? Austin's like a
Mm,
pretty happening place,
for
isn't it?
sure. Yeah,
I'd go
yeah,
there.
it is. It's very busy. It's
Gotta
very
go there
busy.
and wrangle me like a cattle or something.
Good luck.
There are none, right? I'm just like so
Not,
off.
yeah, not in the city. I mean, for sure in the country outside of Austin. But yeah, I always think that's funny. The rest of the world thinks Texas just has like bull horns on their trucks.
Well, that's so funny because like the same thing with New York. Everyone hears New York and like, oh yeah, the city. It's like, well, there's upstate and there's all this beauty country up there, and then there's also
Hmm.
the city, but then there's the suburbs. And yeah, no, I hear you on that. So
Yeah.
so actually, I mean that's where you started, right? Was with your practice was in
Hmm.
Austin.
Yep. That's where I started my practice was Austin in 2013. But I actually started before that in Colorado working at community mental health
Mhm.
in Boulder. So, but I didn't start my own business till I moved to Texas in 2013.
Okay.
Yeah.
And the designation is LPC, right? So
Hmm.
licensed
Professional
professional
counselor.
counselor. Yes.
Hmm.
Trying to beat you
Yeah.
to
Oh,
it.
I know.
And so, as an LPC, what do you do?
So basically, it's just a fancy word for counseling or therapy. So there's a bunch of different avenues that you can go into private practice. And LPC was the one that I chose. It tends to be more focused towards counseling and therapy, people in general, not necessarily specializing in one group of people like families or children or social work. Social work tends to be more of an organizational type counseling model, so you see a lot of people in hospitals with social work degrees. But I knew I would eventually want to open my own practice. I felt like LPC was the best avenue for me. But honestly, it's different state by state. So yeah, in Georgia, LPCs were just granted the ability to be able to diagnose people not too long ago. But in
Okay.
Colorado and Texas, this had been happening for many, many years. So it's just interesting that each state has their own laws around it.
Yeah, and I mean, I actually was joking. I said the other day in the email, like, "Oh yeah, I'm going to bring up COVID-19," but this is so genuine right now. It does seem that that's kind of almost pushing us forward into more reciprocity because you've
Mm.
mentioned three different states now that you've worked in and how they've been so different. I've
Hmm.
heard that there's starting to develop some kind of increased reciprocity between states in the
Hmm.
U.S. I don't know how it
Hmm.
affects your practice, but I know that.
That's a great question. I haven't really looked into it, but you're not the first person to bring that up to me. I had another doctor actually brought that up to me too and asked if our organization was starting to lower the licensee challenges with state to state due to COVID. And, you know, I said, I didn't think so, but it could be happening. I know that they've lowered standards when it comes to HIPAA compliant video software programs. They allowed almost every platform except for things like Facebook, but they allowed like Duo and FaceTime and the things that kind of come on phones, so that people could get services easily and not have to just pay for HIPAA compliant software programs.
Okay. Did you talk to Dr. Hackey recently? He actually mentioned the same thing.
Did he? No, this was a different doctor.
That's so funny.
That's what I haven't talked to him during this COVID season yet.
Okay. He's a wealth of knowledge. Like I said, I talked to him recently and he mentioned the same.
Isn't he cool?
Platforms. Yeah.
Yeah, I like him a lot. Yeah.
No, so actually it's funny you mentioned that LPC, so counselor, it's kind of like a general thing, and that's so similar to physical therapy. And you know, we come out and it's like physical therapist is just, you know, it's a general thing, and then you can kind of like go in your different avenues, and it sounds like that's kind of the same thing with you. Did you happen to take a specific avenue that?
Well, I knew all along I was going to be a sex therapist before I knew I wanted to be a counselor, before I even went into graduate school or knew which avenue to choose. I knew my end goal was sex therapist. So, and that sort of aspect, like I know this sounds awful, but in my mind, it didn't really matter which avenue I picked to get to sex therapy. Sex therapy was my ultimate goal. So that was my specialty I wanted, and I just needed a license to be able to do that specialty. So some people are different. Some people go into grad school and they don't know what their subspecialty is yet. They think, oh, maybe I'll work with women, maybe I'll work with children, maybe I'll work in depression, anxiety. But for me, it was different. I just knew what I wanted to go into. I might have totally skipped over your question. What was it?
No, that was
okay,
it.
Okay, good.
That was exactly it. Yeah. you did
I
it.
just realized that I was like, wait a second. I don't think I knew exactly what his question was.
No, that was, I mean, that was a beautiful answer too.
Okay.
And I kind of, I was thinking as you were talking about how you didn't know, like you knew, but like some people didn't know. It's amazing because you get to grad school and you think like, yeah, like they always say, like once I get to college and it's like, oh wait, you know, I don't really know. But then you get to grad school and for sure I'll know. It's like, well, I got to grad school and I don't really know. It's the same.
Yeah. You see that a lot with doctors too. Some doctors know exactly where they want to go. And then some doctors are like, ooh, I don't know exactly. I just taught a class at Emory's nursing program and spoke to some of the nurses. There was only about maybe 8 or 10 of them. And some of them knew exactly what type of nursing they wanted to get into. And some were more general and they weren't sure exactly what yet. So it just depends. I mean, I'm sure you just got to get moved when you're moved, right?
Yeah, no, it's so true. I mean, similar to you, I knew right away. I was like, pelvic floor physical therapy. That's it. I think it took one semester for me to figure it out. And it wasn't even like any class that really brought it up. It was just some weird, kind of on a whim. I looked it up and I was like, oh yeah, this is it. And I went with it. But good for you for always knowing that you want to be a sex therapist, because then you know, like as you go forward, like everything you learn. And that's probably what makes you so great at what you do. I mean, I know I've sent a handful of people your way for services. Because, I mean, what you do is so essential to pelvic floor physical therapy. I'm only so qualified, and it's only so far in my scope of practice to talk someone through, you know, something that might be cognitive related, and then it's got to go off to someone who's a professional like yourself. What kinds of conditions might someone such as myself send someone to you, or maybe someone off the street just says, I know I need to go see a sex therapist? What things?
Well, and the weird thing about, you know, you think sex therapy is like a subspecialty, but there's even more subspecialties within sex therapy. So anything to deal with sex would go to a sex therapist. that sex therapist might not actually cover your sexual issue, but somebody will. So just pertaining to what I do, first of all, I also want to say that I couldn't do what I do without people like you.
Well, thank you.
Yeah, I mean, I can't, I'm not allowed to touch people, so I can't help them get
Just in a
through.
different way.
Yes, exactly. I can't get through some of the actual hands-on experience with the anxiety and dealing with the anxiety in the moment and the hands-on techniques like you do. And I always love that because I can only go so far with the anxiety, and then we got to get to the practice. And that's what I love pelvic floor physical therapy for, is that I get to say, okay, this person's going to help you with that. But by the way, they're not going to jump like in the deep end. Okay, sorry, you asked a different question. So I deal with pelvic
You're
pain.
fine. Go with it. I love the answer. It was still on the same track. You're great.
I jump around. I deal with pelvic pain for women and men, and anxiety in the world of sex. So it might be anxiety in your body, or it might be anxiety in your head about your sexual experiences. And then I deal with trauma, and so the anxiety piece might be premature ejaculation, it might be erectile dysfunction, it might be vaginismus, it might be dyspareunia, so it might not be quite like a label on the pain with sex. And it also might just be a disconnect sexually with your arousal. So perhaps you're not able to achieve orgasm with partner or alone, or it takes you, you have an orgasm too quick, or it takes you too long, so that anxiety piece and the disconnection with the body is where I really like to dive into and connect with people. And then another subspecialty is I work with gender diverse clients to help them figure out where they are on the spectrum, or if they have like an avenue of where they want to go with surgery and hormones, I can help them with that and cope with all the changes that goes along with transitioning.
That's great. So it sounds like you see them both before and after it.
Oh yeah, all along the way.
No, that's great. Do you feel like that's essential, like being talked through before and after? Because I definitely get people who I work with, just maybe not gender diversified like you had mentioned, but people who do need therapy, physical therapy before a surgery and then after, but maybe they'll only come to one or the other. But do you find that people tend to do better before and after, or one versus the other?
I would never say that I think people need therapy before they get surgery. I never want to be like a gatekeeper to say that this is what you need before you get that. And then at the same time, I always think it's helpful to have a real honest conversation to talk about some of the goods and the bads that come along with surgery, and just talk about your fears. And I think that when people know that as a therapist, my job is not to get in your way, it's just to help explore all of your fears and excitement, that I'm never going to tell you yes or no, if you're this or if you're that. That's not my job.
Okay.
I just want to help you transition with whatever you're doing easiest. So yeah, I mean, it's helpful if that's what you want to do, but it's not going to be helpful if you feel like you're forced into it.
That's fair. That's a great way to look at it. So essentially, if I'm understanding correctly, you kind of help them. It's not even that you lead them to the answer. It's you just kind of help them along the way, maybe as they're trying to get to that answer. And it sounds like you let it come very naturally to them. So that is great. What are some techniques that you use with people? So in terms of like trying to guide them, or maybe someone with pelvic pain, you mentioned the anxiety. Are there special techniques that you might use?
Yeah, I mean, it depends on what the anxiety is. But for example, I have a desensitization worksheet that I lead people who have pelvic pain during intercourse. And so if they have a partner, this worksheet works a little better, but I can tailor it to be like, more individual sexual exploration stuff. And that's very helpful. It's about 20 plus items on the list, and many of them have like an A, B, and C. And I like to do, it's literally, let's go to the anxiety, let's sit in the anxiety and let's cope with it in our bodies and learn to be able to relax ourselves and be in that moment. And so oftentimes I'll say, for example, it's a cis female who has pelvic pain when she's trying to have intercourse. I'll say, like, intercourse is off the table. We're starting with step one. Like, intercourse is not allowed. And the relaxation that they
Yeah.
have from that,
Oh yeah.
it's been spoiling their makeout sessions.
Yeah.
In the back of their head, they've been worried about painful sex. So they haven't even been able to make out in a way in which to be present.
Mm-hmm.
So we go to the very beginning and kind of work through all that anxiety. And then by the time we get to the big shebang, whatever, it's not so bad. We're not jumping over a huge hurdle anymore because we had so many hurdles along the way.
Absolutely. And I love that word that you use, being present, just
Mm-hmm.
being present in the moment and just kind of
Mm-hmm.
enjoying that moment for a moment. That's so essential,
Mm-hmm.
especially
Mm-hmm.
in your pelvic pain population, the pelvic pain during intercourse,
Mm-hmm.
just
Mm-hmm.
trying to enjoy one piece at a time. So
Right.
that's great that you mentioned that.
And not getting overwhelmed. And
Mhm.
if you are overwhelmed, dial it back even further, something that's even safer. Because we ultimately want the person dealing with and coping with the anxiety and feeling out of control to feel in control and to
Mhm.
feel present in their body. And if they're not able to, then that means we got to keep backing it up a bit until they can get to that spot where they can be like, okay,
Mhm.
yes, I'm feeling this, So we
And,
might do a lot of grounding stuff in session to get them even to that point of
and
feeling their
some
body.
people just need that validation that it's okay. Because
Mm-hmm.
if you think about all the stuff in the media and in movies and TV shows, it's sex, 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 all the time, sex. I was I don't know what world this is that people are living in, but it's totally setting people up for failure.
Mm-hmm.
And
And
it's
they're,
great to have an educated person like yourself come and say, hey, listen, that's not that this is more, it's more normal to just enjoy it in what you're
mm-hmm.
doing, and the not sex direct sex part of it. So
Mm-hmm.
so
Mm-hmm.
true.
Yeah. And everybody's instantly aroused too. There's no foreplay. They just lift up the skirt and go at it. It's
Oh my god. It was, yeah, no, you hit it right on
no.
the nail. The nail right on the head, rather.
Yeah.
Something that you brought up to me once that I thought was amazing, and I've never used it. I haven't used it with anyone because it's totally your thing now.
No, you should use it.
No, no, it's amazing. But can you think of what I'm going to bring up? Do you know?
No,
Oh my gosh!
no.
All right, you told me you have people occasionally, when appropriate, write a letter to their vagina.
Mm-hmm.
That
Mm-hmm.
that blows my mind. And I think I asked you where you came up with it. You said it just kind of came to you, and
Mm.
that was genius. And I love the ingenuity that you have, the creativity to help people work through those things. Because I mean, that's just one of those, when you said it was just like that. Oh my gosh!
Yeah.
I wish I thought of that. It's genius. It's so perfect. And then you
Yeah.
have them write a letter back, right? Is that
Mm-hmm. Mm-hmm.
they have to
From their
stamp
vagina's
it
point
and
of
put it
view.
through U.S. Post? Is that
Yes.
part of
Whatever it
it?
takes.
Yeah, exactly. I thought so.
Yeah. Yeah.
Overnight it.
Yeah.
So
Yeah.
do you
That's
want to
really
share that a
fun.
little bit about that? Where
Well,
you got the idea and
I don't
everything?
know. I think I just got the idea in session. It felt right in the moment. And then I just used it again and again and again. And it's so cool to see when you're speaking to a part of your body that you've been disconnected to and maybe blaming and mad at and feeling like it's broken, for you to treat it like a person, treat it like a part of you that deserves respect and actually has a mind and an opinion.
Mm-hmm.
Um, and for you to tell it maybe how mad you are at her and or sad or scared, and then for her to be able to talk back to you, right?
Mm-hmm.
Or him. I don't want to
Yeah,
assume any sort
I've
of gender of your body parts, right? Because
right,
this
right.
could go any sort of way. We could talk about any genitals in this area.
Yeah.
um yeah, I recently did this with another client, and they did poetry, and it was just, Oh, it was
Poetry to the
so,
vagina.
yeah.
Oh,
Yeah.
poetry to the penis, poetry to the I think we could like trademark
Oh man, it
something
was
here.
amazing. It was so cool. So to see people's creativity, and that's scary, right? Because also not all of us are writers. So it's kind of scary to then bring that up to your therapist or show somebody
Mhm.
that. So there's this vulnerability piece that's very important in therapy for you to kind of allow yourself to be seen in this sort of way.
Yeah.
But it's cool. It's a neat technique. And there's no right or wrong way to do it, you know?
So there isn't a certain type of poetry they have to do. It doesn't have to be like the what
Mm-mm.
I'm trying to think of the different types of poetry. I'm
Haiku.
totally gonna.
That's the only
Yeah,
one I
yeah, there you
know.
go. The haiku. It doesn't have to be a haiku. Those ones
Yeah.
are always impossible.
Yeah. Yeah. Like 4, 7. I don't even know how many it
Oh
is,
man, I
but
know
there's numbers
it's gone
involved.
now. It's
Yeah.
gone. We don't.
Mm-hmm. It's gone.
No, that's great though. Honestly, I mean, I'm just to experiment. I keep a journal. I might start writing letters to my different body parts too, just to see what I come up with. See
Mm-hmm.
from the eyes of the patient, maybe.
Mm-hmm.
I love doing that. I always try to like find a way to empathize
Mm.
in some way. So yeah, no, I think maybe tonight I'll have to write. I won't disclose which part, but I think tonight I'm going to write to something.
I love it. I love it. You know, and I think that's so important too when it comes to our professions is understanding what our clients are going through when we ask them to do things. You know, so as a therapist, like I want to be in therapy. And as a therapist, I've gone to pelvic floor physical therapy because I think it's important for me to be able to say, like, it's kind of what it was like, you know, and I might not even tell them I did it, but I can speak from a different kind of angle. And we can't do that with everything,
Mhm.
right? But as much as we can to be able to say like, well, I did that too. Like I tried that and it,
Mhm.
you know, here's what
And
I
just
found helpful or
yeah, and I understand a little bit of the maybe embarrassment of it of
mhm,
writing or going through an assessment or having to divulge XYZ to someone. You
mhm,
know, just it definitely helps. It's almost like that little bit of like the anxiety goes
mhm,
down a little bit even
mhm,
when they're in front of you.
mhm.
That's so yeah. No, that's great that you do that too. So. Do you have any like suggestions to people in terms of um, like when they should maybe seek, I want to say, professional help for something physical cognitively versus like is there
Mhm.
something that goes off in your head where I might say, oh man, like it's hurting me here, but I know that because of this I should just skip the middleman and head over because we have direct access now
Mhm.
to our counselors. Is there anything that you could think of physical that maybe someone would come to you directly?
Instead of going to you first.
Yeah, absolutely.
You know, I think people come to both of us in their own sort of ways. So I'm guessing like people do a Google search or they talk to their, you know, doctor and their doctor sends them off. But in my opinion, I think whatever feels more comfortable for you, then go there first and then explore. So I have a lot of people come to me first because pelvic floor seems to be, and so does sex therapy, but pelvic floor physical therapy seems to be just so unknown. And
Hmm.
so they'll find me and then I'll push them towards you. And they're like, I've never even heard of this. And I'm
And
sure
then
you
you
get
see me
that
on
the
the other
same
side, like,
way.
no, I'm just
Yeah.
kidding. Go back. You need her. No, I'm just kidding.
um, but, you know, I mean, and I say to people, it's helpful to do it at the same time, but if you can't do it at the same time, pick whichever one you're more comfortable with. So if you're more comfortable with going with the like medical model and dealing with your body right now, do that. If you're more comfortable with talking about it, then do that. Or if you can and you have enough money to do them both at the same time, then great.
Hmm.
Like do it both at the same time. So I mean, there's no one way
There's
fits all, but
that's fair. Yeah, there's no like cut dry black and white answer.
mm-mm,
That's the case with so many things. So
mm-hmm,
that's a great
mm-hmm,
answer. And you know
mm-hmm.
what? I just realized. I know you have a family, and it's getting a little late.
Do
You're
you hear
still
them screaming?
work. Oh, okay. So they're in the background there. Yeah. No. How many kids do you have? I think you
I
have
have
two.
two.
Yeah.
Yeah, I have two, 5 and 7.
Okay.
Yeah.
Those are such wonderful ages because they're like out of their terrible twos. I have a 7-year-old here, so it's
Yeah.
a good age. You can start playing with them a little bit more, and they're a little
Mm-hmm.
more interactive with
Yeah.
you. Okay, but yeah. So just before we kind of sign off here, how can people find you? Like, where do they go if they want to
Mm-hmm.
find Tali Boots? They're like, hey, I saw that podcast, Tali. She's amazing. She's easy to talk to, and that Nick guy is so hard to talk to. She made it seem seamless. I need to get to her. What websites and things like that? What do you got?
Yeah. Yeah. So, I mean, if you just Google Tali Boots, I think I'm the only one. So that's a good idea. But you can also, if you don't know how to spell Tali, sextherapyofatlanta.com is my website. And
What if I
then
don't know how
like,
to spell .com? No, I'm just gonna go on.
I know, .c as in cat. Um, and then another really great website that I like to tell people about, because I feel like it's just a plethora of information in the world of therapy, is psychologytoday.com. And within that, you can put in your zip code. You can put in if you want somebody to take insurance or private pay. You can put in your subspecialty. You can mark a couple different specialties. And then you see everybody in the list. So I'm in there somewhere, I'm sure. But sextherapyofatlanta.com, or you can just Google Tali Boots.
All right, great. And Boots spelled like
Boots, and
yeah.
Tali spelled Tali.
All right, perfect.
Yeah,
Well, again, I appreciate your
I
time.
should put a little thing right here.
I know, right? If I figure I'm not that good with technology, so
Flying texts.
yeah, fine. Text. I'll have to hire someone. Honestly, I'm just so thrilled that this went so well one time through. So I don't
Yay!
have to do much editing. I just have to like edit my face out. No, I'm just kidding. But yeah,
Mm-mm.
no, this
No,
is.
you're doing such a great job at this. You're such a good interviewer.
Oh, thank you. You've been a great
Yeah.
interviewee. Um, I wasn't lying when I said you are so easy to talk to, but it probably comes with the territory of being a counselor, right?
I don't know. But I just try to be genuine and, and
Fair
connect to
enough.
people but I think you are too. I think you come across very, very genuine, knowledgeable, calm, which is always helpful when you have to deal with so many body anxieties, and for you to just have this nice, calm presence that everybody can just relax into is really, really lovely.
Oh, go on. Don't. No, I'm just
Okay.
kidding.
I will. I
All
don't
right,
have
well,
time. I've got to go.
I know, right? Well, anyway, yeah, thank you so much, Tali,
Of course.
and
Thanks,
I look
Nick.
forward to working with you in the future.
Let's do
Continue.
it.
All right, take care.
Bye.